That first step out of bed in the morning. You know exactly what I am talking about. Your feet hit the floor, you push yourself up, and before you have even fully stood, your knees announce themselves. That stiffness, that ache, that grinding reluctance that takes several minutes, sometimes much longer, before it eases enough for you to walk to the bathroom without thinking about every step. You have probably assumed this is simply what mornings feel like now, that it is the price of getting older, something to accept and move through. I want to tell you today that this assumption, while completely understandable, is costing you. Because morning knee pain is not random, it is not simply age, and in most cases, it is not something you have to keep living with at the level you are currently experiencing it. I am going to explain to you exactly why your knees hurt more in the morning than at any other time of day. The actual physiological reason, which most people have never been told clearly. And then I am going to walk you through specific evidence-based things you can do about it. Not vague advice, not generic stretching tips you have already heard, practical, targeted interventions that address the actual mechanism behind morning knee pain. And I want you to stay through to the end, because the last thing I share is the one that makes the biggest difference for most of my patients, and it is also the one that almost nobody is doing. Let us start with why. Why do knees hurt more in the morning specifically? Why does pain that may be manageable during the day feel so much worse during those first minutes after waking? The answer comes down to three things happening simultaneously inside your joint while you sleep, and understanding them changes everything about how you approach the problem. The first is what happens to your synovial fluid overnight. Your knee joint is enclosed in a capsule, and inside that capsule is synovial fluid, a thick, viscous liquid that lubricates the joint surfaces and allows the bones to move smoothly against each other. This fluid does not circulate on its own. It moves and distributes itself through the mechanical compression and release of movement. When you walk, when you bend your knee, when you shift your weight, you are actively pumping synovial fluid across the joint surfaces, keeping them lubricated and nourished. When you sleep, that pumping stops. You lie still for 7 or 8 hours, and the synovial fluid pools and thickens, becoming less evenly distributed across the joint. When you first stand in the morning, those joint surfaces are working with reduced lubrication until movement begins to redistribute the fluid. That is part of the reason the first minutes feel so rough. Your joint is essentially running dry until the pumping action of movement warms it up. The second thing happening overnight is related to inflammation. Most people over 50 who experience morning knee pain have some degree of inflammatory activity inside the knee joint. This includes osteoarthritis, which involves not just wear and tear, but a genuine low-grade inflammatory process. Inflammation is regulated in part by cortisol, the body's natural anti-inflammatory hormone, which follows a daily cycle. Cortisol levels drop to their lowest point in the middle of the night and begin rising in the early morning hours. The period of lowest cortisol corresponds with the highest level of unchecked inflammatory activity inside the joint. This means that the inflammation in your knee is literally at its peak level in the early morning, before your body's own anti-inflammatory response has fully kicked in for the day. The pain you feel in those first morning minutes is in part the experience of that unchecked overnight inflammation before your cortisol levels have risen enough to moderate it. The third factor is joint capsule contraction. The connective tissue surrounding your knee joint, the capsule, the ligaments, the tendons, all have a slight tendency to tighten and contract when they have been at rest for a prolonged period. This is partly a temperature effect, as these tissues become slightly stiffer at the cooler body temperatures of sleep, and partly a consequence of reduced blood flow during rest. A contracted joint capsule reduces the available range of motion, increases pressure within the joint, and contributes significantly to that feeling of tightness and resistance that makes those first steps so uncomfortable. So, you have reduced lubrication, peak inflammation, and a contracted joint capsule all occurring simultaneously in the minutes after you wake. That is not a coincidence. And it is not just aging, it is a specific set of physiological events that you can directly influence with the right approach. Now let us talk about what to do about it. And I want to be specific because the generic advice most people receive does not address these mechanisms directly. The first thing, and the one that addresses all three factors at once, is warming the joint before you ask it to bear your full body weight. I want you to think about this differently than you might have before. The problem with stepping out of bed and immediately walking is that you are asking a cold, under-lubricated, inflamed, stiff joint to suddenly accept your full body weight and the mechanical demands of walking before it has had any preparation. This is the equivalent of starting a car engine in freezing weather and immediately driving at highway speed. Everything about it is working against you. What I recommend to patients instead is this. Before you stand, while you are still in bed, spend 3 to 5 minutes doing gentle range of motion movements with your knees. Bend and straighten each knee slowly, repeatedly, through whatever range is comfortable. Pump your ankles up and down. Gently slide your heel toward your body and back out. These movements are not exercises in the traditional sense. They are warm-up movements that begin to redistribute synovial fluid across the joint surfaces, gently stretch the contracted joint capsule, and stimulate blood flow to the surrounding tissues before you place any weight on the joint. 3 to 5 minutes of this before you stand makes a measurable difference in how those first steps feel, and my patients who do this consistently report it as one of the most impactful changes they have made. The second thing is heat application, and the timing of it matters. Applying gentle warmth to the knee joint in the morning, a warm compress, a heated pad on a low setting, or even a warm shower directed at the knee, directly addresses the joint capsule contraction and stiffness by increasing tissue temperature, improving local blood flow, and reducing the viscosity of the synovial fluid so it distributes more easily. Heat works best before movement, not after. The sequence that works best is heat for 5 to 10 minutes, followed immediately by gentle movement, followed by gradual weight bearing. If you have a shower in the morning, spending an extra minute or two with warm water directed at your knees before you finish is a simple and effective version of this approach. The third thing is something that happens the night before, and this surprises a lot of patients when I bring it up. The position your knees are in during sleep significantly affects how stiff they feel in the morning. The most problematic position is sleeping with the knees bent at a significant angle for the duration of the night, which is the natural position for side sleepers who bring their knees up toward their chest. Maintaining this bent position for hours causes the connective tissue around the knee to adapt to that shortened position, which is a large part of why straightening the knee in the morning feels so resistant and uncomfortable. Placing a pillow between the knees for side sleepers or under the knees for back sleepers helps maintain a more neutral joint position through the night and consistently reduces the degree of morning stiffness my patients report. It is a simple, free intervention that requires no effort during the night and often produces a noticeable difference in morning symptoms within a week of consistent use. The fourth thing is addressing the overnight inflammatory peak directly. There are two approaches here, and I want to be transparent about both. The first is nutritional. Certain dietary choices in the evening have been shown to modestly influence overnight inflammatory activity. Foods that are high in refined sugar, processed carbohydrates, and seed oils consumed in the evening promote systemic inflammation, including within joint tissue. An evening meal that is higher in protein, healthy fats, and vegetables, and lower in processed foods and sugar may help moderate the inflammatory environment inside your joints during the night. This is not a dramatic intervention, but over weeks and months, it contributes meaningfully to the baseline inflammatory level your joints are working with. The second approach is a conversation to have with your doctor, which is whether there is an appropriate anti-inflammatory strategy for your specific situation, whether that is a topical gel applied to the knee before sleep, an oral anti-inflammatory taken at an appropriate time relative to your overnight pain pattern, or other targeted interventions based on the underlying cause of your knee symptoms. I raise this not to suggest medication is always the answer, but because the overnight inflammatory peak I described is a real pharmacological phenomenon, and there are cases where addressing it medically in conjunction with the other strategies I have described produces significantly better outcomes than lifestyle approaches alone. The fifth and final thing, the one I promised at the start, the one most people are not doing, is specific strengthening of the muscles that directly support and protect the knee joint. This is different from general exercise. The muscles I am referring to are the quadriceps, which run along the front of the thigh and are the primary stabilizers of the knee, the gluteal muscles, which control the alignment of the entire lower limb and directly affect the load distribution across the knee joint, and the calf muscles, which influence knee mechanics from below. These muscle groups collectively determine how much of the load of standing, walking, and movement is absorbed by the muscles versus transmitted directly through the joint surfaces and cartilage. When these muscles are weak, and in most people over 50 who have chronic knee pain, they are significantly weaker than they need to be. The joint absorbs far more impact and stress than it should. Inflammation increases, cartilage wear accelerates, and morning pain worsens over time. The exercises that most effectively address this do not require a gym. A simple sit to stand from a chair, sitting down slowly and standing up slowly without using your hands to push off, performed in 2 sets of 10 repetitions each day, is one of the most effective quadriceps and gluteal strengthening exercises available. A gentle calf raise, standing behind a chair for balance, raises up onto the toes and slowly back down, performed daily, strengthens the calf and improves the overall stability of the knee. These are starting points, not ceilings. As strength builds over weeks, the load on the joint decreases, the inflammatory burden reduces, and morning symptoms typically improve significantly. I want to close with something I tell every patient who comes to me specifically about morning knee pain. The morning stiffness you feel is not your knee telling you it is broken or that movement is dangerous. It is your knee asking for preparation. Give it warmth before weight bearing. Give it gentle movement before full activity. Give it a better position during the hours of sleep. Reduce the inflammatory fuel in your evening meal and give it the muscle support it needs to do its job without being overwhelmed. None of this is complicated, none of it is expensive, and none of it requires you to push through pain or do anything dramatic. It requires consistency, doing these simple things every day rather than occasionally, and patience, because the changes are cumulative rather than immediate. Most patients who commit to this approach report meaningful improvement in their morning symptoms within 3 to 4 weeks. You do not have to dread getting out of bed. That first step can feel different, and now you know exactly what to do to make it so. Thank you for being here on Mobility Matters. If this video helped you understand something about your own knees that you did not understand before, please share it. Someone you know is waking up every morning with this exact problem and has no idea why. Leave a comment telling me how your mornings feel right now and what you are going to try first. I read every single one, and I will see you in the next video.